Hi, I'm Dr. Katie Chobot at Covington Veterinary Hospital, and I just wanted to talk to you a little bit about what to expect with your pet after dental surgery.
How to care for your dog after dental surgery.
Yeah, one of the first things is when your pet comes home after dental surgery, they're going to be groggy. So you're going to want to probably feed them probably half their normal dinner, and certainly their food is going to need to be softened. Usually I'll do that with warm water over their kibble or transitioning them to a canned food just to allow their mouth to heal and not disrupt the sutures that are in their mouth. They may have a little bit of a soft cough because they've had a tube in their airway to protect their airway while they're under anesthesia. And they may also have a little bit of drooling, even sometimes blood-tinged drool as their mouth is healing. They might even be a little bit tender when they're chewing or eating, and that's to be expected as well. I also would encourage you to pick up all your bones and toys so that they're not coming home right away and chewing and ripping out all those good sutures. We'd like for you to keep those chew toys and bones put away for about 2 weeks.
And what should I watch after my dog's surgery?
Things to watch for is if your dog is having a foul odor in its mouth. The odor should be nice and fresh since they've just had their teeth cleaned. If they're having continued pain with eating, that would be of concern. If you have vomiting, diarrhea, not eating well, those could be reactions to the pain medication, and certainly those are things that we want to know about right away if that's occurring. Or if there's a cough that doesn't resolve within 2 or 3 days after surgery, that's something to let us know about as well.
And what complications can happen after dental surgery in dogs?
Yeah, so one of the things that can happen is that the surgery site can open up, and that's typically from biting or chewing on something. Also, sometimes those upper canines, there was extensive disease and there was already communication between the mouth and the sinus, they can end up with a fistula or a tract communication that is open between the mouth and the sinuses. Generally, we're really proactive about that. It doesn't happen often, but it is something that can happen with advanced dental disease. Also, I see sometimes when dogs have the lower canines removed that they might have their tongue hanging out of their mouth because those canines are holding their tongue in place. It's also possible that they could have problems moving their tongue with nerve damage or numbness of their face, but that's also not a very frequent complication.
How long does it take for a dog to recover from a tooth surgery?
So it's usually about 2 weeks of recovery from dental surgery, and that is a great time for us to do a recheck at 2 weeks, make sure things have healed really well. That's also why we want you to soften food for 2 weeks to allow those delicate gums to heal really well. And by 2 weeks out, they're usually pretty much back to normal. Actually, most clients come in at their recheck at 2 weeks telling us their pets are feeling better than they have for a very long time. And that's the thing that keeps us going and wanting to advocate for quality dentistry for our pets.
And will my pet need pain medication?
Yes, your pet will need pain medication after dental surgery. And there are lots of different forms with that. So it depends on you and your pet and what works best for you. And we're happy to help you navigate that. Mostly we're just advocating that your pet stays really comfortable. We don't want this to be a painful procedure. We want this to be a positive outcome, that it helps them and not causes a lot of pain for them.
And will my pet be able to eat with fewer teeth?
Actually, it's really amazing. Our pets can do really well with missing teeth eating. Even without teeth at all, they can eat really well. Our commercially available pet foods are designed that it's digestible whether it's chewed or not. The biggest concern would be making sure if you're giving them a dry kibble that the kibble is small enough to be swallowed, but generally they're going to still be able to eat really well, oftentimes better than when they had painful infected teeth in their mouth. If you have any further questions, feel free to contact Covington Veterinary Hospital.